Welcome today to the LBA's Zoom meeting regarding the changeover to Advantage Care through Empire and Blue Cross. With us today will be representatives from Alliance to go over the program, to answer questions that members have sent in to us already. We've taken those questions, myself, Bill Lonnie, Marion Pellegrini, who's here with us today. We presented them to the Alliance. They've done this before, so they've taken all the questions that have been given to them and bring it into their presentation. Just to give you the playbook, we're recording this today, so the members that are all throughout the country who can't get on today, they'll be able to go on our website and take a look at it. We're going to take the questions today that you guys and gals email to us. We're going to take those questions and present them to the Alliance in the future to get back to our members. Obviously, during the presentation, if there's questions for in the future, we want you to send them to us so we can get answers for you. We understand that this is a major shift for some people. We understand how healthcare is very personal, a very important thing for our members. We take it just as important as you do. Our goal with the LBA is to try to help our members transition over or to stay where they are and do it as seamless as possible. We understand that may be a lot of work on our end, and we're going to use all our resources to help you with that. But I think the first part of the this presentation, coming from the Alliance to explain what this really is, I think it's really imperative that we get that done for you. So what I like to do is open it up now to the Alliance. I think Kim Park is on right now. She'll be able to start her presentation. And then if we have questions here in the LBA in the office, we'll bring them to Kim from the members that have already sent in their emails. So I'm going to turn it over to Kim from the Alliance to start the presentation. Kim.
Thank you, Lou, and thank you to the entire LBA leadership team. I appreciate the opportunity to be able to meet with you retired members. And the ultimate goal from today's meeting is to really educate the members, give them all the information they need in order to make an informed decision as to what they want to do for their healthcare plan. So today's presentation, we're going to talk about the overall Medicare Advantage Plus plan structure and how it compares to traditional Medicare and the senior care plan that's in place today for many of your members. We'll spend quite a bit of time talking about the national provider access and all of the physicians that your members are going to have access to throughout the country. I'll review through some of the enhancements or the additional benefits that retirees will receive that are not currently covered under traditional Medicare or the senior care plan today. We'll do a high-level benefit comparison, and then throughout the course of the presentation, I'm trying to weave in many of the most commonly asked questions that have come up in prior retiree presentations that we've done, so I can proactively address many of the concerns and questions that are top of mind for your members. This slide shows an overview of how traditional Medicare works in comparison to a Medicare Advantage program. And before I go into the details of the structure of the program, I do want to let all the retirees know that this particular program, the New York City Medicare Advantage Plus plan, is a custom plan that was specifically created for the City of New York and the City of New York retirees. This is not an individual off-the-shelf product that any individual can purchase. This is truly a customized program that was created for the city. It is a national PPO, which means retirees have the ability to live anywhere in the United States or their US territories, and this coverage will cover them. So under traditional Medicare, on the left-hand side of the screen, you'll see Medicare is divided into two parts. Part A, which is your hospital benefit, and Part B, which is your medical benefit. And then secondary to that is your supplemental coverage through the GHI senior care plan. Under the Medicare Advantage Plus plan, we're rolling all of those pieces together into one program. So we become the administrator of your Medicare Part A and Part B benefits, as well as your secondary benefits. So by rolling all of those pieces together into one program, it's a simplified experience for the member. You have one single identification card, so you no longer need to show your Medicare red, white, and blue card, your GHI medical card, and your Empire hospital card. We're combining all of those pieces into one with one single identification card. And what that also means is you're going to receive one single EOB. So you're no longer going to get separate EOBs from Medicare and then from GHI or from Empire. So all of this will be combined under the one program. Because we're contracted with the federal government to administer Medicare benefits, the baseline requirement is we have to cover everything that traditional Medicare covers today. So if it is a Medicare covered service, that service will be covered under the Medicare Advantage Plus program. We follow the same Medicare coverage guidelines, and we follow the same Medicare medical necessity guidelines as well. So if it's a Medicare covered service today, it will be a Medicare covered service under the New York City Medicare Advantage Plus plan. I do want to call out a few of the enhancements. I'll go into a lot more detail a few slides later, but some of the additional things that you're going to receive under the Medicare Advantage Plus plan that you don't get today are Silver Sneakers, for example, which is a free gym membership. You'll also have a routine transportation benefit, healthy meals, and a healthy pantry benefit. And I'll go into those in a little bit more detail. Probably the most important question that is on every retiree's mind is access to providers. Will I be able to continue to see the same providers that I'm seeing today? Members will have access to all Medicare participating providers across the country. And there are approximately 850,000 providers that participate in traditional Medicare today. But what's really important to note is out of those 850,000 providers, over 640,000 of them are actually in-network contracted providers that participate in the Emblem Health, Empire, or the National Blue Cross Blue Shield Association networks. So what's important there is you're not bound to a network, so you don't have to use an in-network Blue Cross Blue Shield provider. You can see any Medicare participating provider. It is a national PPO, and it's a passive PPO. And what that means is the passive PPO component is if you use an in-network provider or an out-of-network Medicare provider, that claim is treated the same. So your copayment will be the same whether the provider is in the network or out of the network. Now, what's important to note here is we leverage the Blue Cross Blue Shield national network of providers. So if a retiree lives in Florida, the providers that they're going to access are the Blue Cross Blue Shield of Florida providers. If a retiree lives in New Jersey, they would be accessing the Horizon Blue Cross Blue Shield providers. So we leverage all of the individual Blue Cross Blue Shield plans in all of the various states throughout the country. So it is truly a national program that members will have access to all of these providers. I wanted to call out specifically, questions have come up regarding Memorial Sloan Kettering and Hospital for Special Surgery in New York. We are very close to finalizing the in-network contract with both of those facilities. So they will be accepting the program come January 1st. Some retirees like the peace of mind to know if their providers are participating in the network, just as peace of mind. There's two easy ways to confirm if your doctor is participating in the network. I want to emphasize that they don't have to be participating, but if you do want to confirm if your doctors are in the plan, you can call the New York City Medicare Advantage call center, which is 833-325-1190. Or you can use the website that's on the OLR website that has a hyperlink to the Empire site that has the Find Care tool. And you could go through the Find Care tool. Make sure when you're searching for providers, you put in the city and state or the zip code and the full name of the provider. Do not put doctor before their name, just put the first and last name, and that will allow you to search the provider finder tool. I mentioned earlier all of the enhancements. I want to review some of them with you right now. I mentioned Silver Sneakers, which is the free gym membership. There are over 16,000 Silver Sneakers locations that participate in the plan nationally, and it's a portable program. So if you want to utilize a Silver Sneakers gym in New York and then a Silver Sneakers gym in Florida for the winter months, if you're a snowbird, you can do so. So your Silver Sneakers benefit goes with you wherever you are in the country. I wanted to note the Concierge Health Guide, and this is the customer service team that's going to be there to support all New York City retirees. And this is not just your standard customer service team. This is, I call it customer service on steroids. This team is there not to just quote benefits, look up claims for you and look up EOBs. They're actually there to help retirees navigate the program. So they're there to advocate on your behalf. They will even get on the phone and schedule doctor's appointments for you, and they will help coordinate enrollment into some of the other programs that are offered through the plan, one of them being the non-emergency transportation benefit. So all members will receive 24 one-way trips to and from doctors, pharmacies, or hospitals. You'll want to coordinate this 48 hours before your appointment. And once again, the Concierge Health Guide can help assist coordinating setting that non-emergency transportation car service up for you. There's also telemedicine or Live Health Online. And this is the virtual doctor platform where members can actually have a doctor visit with a board certified physician virtually over their smartphone, their tablet, or their computer. And you can access the Live Health Online 24 hours a day, and those providers have the ability to call in prescriptions. So it's a very convenient way if you want to have a quick provider visit and have something simple taken care of. We also have behavioral health on the Live Health Online application as well. The Healthy Meal Benefit is designed for post-discharge from the hospital. Members could receive up to 56 meals delivered to their home each year post-discharge from the hospital, or they could qualify if their A1C levels are elevated or if they have a certain body mass index. So the last thing a member wants to deal with when they come home from the hospital is worrying about cooking for themselves. So the Healthy Meal Benefit is really there to help members stay on track and really prevent readmissions back into the hospital. We also have the Healthy Pantry Benefit, which is designed for members with certain chronic conditions, where it's proven through some dietary changes, you could help manage that condition better. I always use a diabetic or a cardiac patient as a good example. Members will receive a shelf-stable pantry box delivered to their home each month, as well as a nutritional counseling session with a dietitian each month so that they stay on track. We also have rewards for members who do their wellness screenings and preventive screenings. So we want to incentivize members for doing those screenings. So you have the ability to earn gift cards for every time you do a wellness or screening activity, such as your annual physical or your colonoscopy or mammography. You have the ability to earn a gift card reward. For those that are tech savvy, we have our Sydney mobile app, which will allow you to actually access your benefit program directly over your smartphone. You'll have access to your full benefits. You can review EOBs. You can also view and download your identification card, and you can show that to providers. There's also the 24/7 nurse line, and this is something different than the Live Health Online app. This is a nurse line that's staffed 24 hours a day, 7 days a week to help members triage their conditions. So quite often, retirees will utilize this phone line in the middle of the night. Something comes up, they don't know if it's severe enough, if they should go to the emergency room, or if it's something that can wait until the morning. The nurses are there to help triage their symptoms and make sure that they are directed to get the appropriate care. There's worldwide emergency room and urgent care. So this is important to call out because under traditional Medicare, Medicare does not cover you outside of the United States. You will now have coverage worldwide for urgent and emergency care. We also have special offers, which allows our members to receive discounts for certain services with preferred vendors, such as LASIK surgery or vitamins or dietary programs like Jenny Craig. We also have the Medicare Community Resource Support. And this is a team that helps coordinate Medicare community resources right in members' neighborhoods. So often there are many neighborhood or community resources that retirees don't even know are available to them. And this team helps connect the retiree with the community resource support that's available to them in their neighborhood. Routine foot care is also covered under the program. This is something that's not covered under traditional Medicare unless you're a diabetic. So routine foot care will be covered for all members, and it's 12 routine foot care visits per year. We also have the health and fitness tracker, and this is basically a Fitbit. A retiree would be eligible for a Fitbit every 2 years, as well as the ability to access the online health and fitness tracker programs. Noted on this slide is a high-level benefit comparison between the GHI Senior Care Plan and the New York City Medicare Advantage Plus program. And I do recognize that not every retiree is covered under senior care. Some retirees might have one of the other New York City options, whether it's HIP VIP, or it might be Humana or Aetna, for example. The OLR site has all of the plan comparisons included on their site, so you can go through and see the comparison of your plan as it compares to the New York City Medicare Advantage Plus plan. But because the majority of the retirees with the city are with senior care, we wanted to show a side-by-side comparison between senior care and the Medicare Advantage Plus plan. I do want to call out on senior care, the annual deductible would be the Medicare Part B deductible, and then you would have the additional $50 plan deductible. For 2021, it's currently $253 in total. That will likely change for 2022 because Medicare has not announced what the Medicare Part B deductible would be yet. So you would pay your initial deductible. Under the Medicare Advantage Plus plan, it would be the $253 deductible for 2022. And then there's a maximum out of pocket that the Medicare Advantage Plus plan, and this is a catastrophic protection for members. So that $1,470 is the most you would pay out of your pocket for your deductible and any co-payments that you pay for services. So every time you pay a co-payment, that's going to count towards your maximum out of pocket. Once you reach the maximum, there will be no additional co-payments that the retirees will have to pay. Now, why this is important to call out is because under the senior care program and traditional Medicare, there is no catastrophic maximum out of pocket, which means your co-payments and cost shares can continue. So if a retiree does not have the 365-day hospital rider under senior care, they could potentially be exposed to tens of thousands of dollars of uncovered hospital expenses. So that's why the maximum out of pocket under the Advantage plan is so important, because it has a protection in place for you. Your inpatient hospital care will be a $300 copayment per admission with the $750 per person maximum per calendar year. So if a retiree goes into the hospital 3 times in 1 year, the most they would pay would be the $750. Skilled nursing care is covered for the full 100-day benefit period under the Advantage plan, as well as senior care. And it's a 0 copay for days 1 through 100. Now, for your primary care doctor and your specialty visits, this is where the benefits change a little bit. Under senior care, effective January 1st, 2022, there will be new co-payments that will apply to the senior care plan. Your primary care physician visits will be a $15 copayment, as well as all specialty visits would be the $15 copayment. Under the Medicare Advantage Plus plan, your PCP copayment is 0 and your specialist is 15. Emergency room copayment is the same under both plans at a $50 copayment, and dialysis is a $0 copayment under both programs. I wanted to take this time to just give an overview of how Medicare Advantage programs differ from traditional Medicare and the senior care plan. One of the questions that comes up all the time is the pre-certification process. So the plan, the Medicare Advantage Plus plan, you do not require referrals to see your specialist. So you do not need to go through your primary care doctor to see your specialist. You can schedule your specialty visit directly with your specialist. So it's a non-gatekeeper plan. However, there are some services that may require pre-authorization, and that pre-authorization process is handled by the providers. It is not the member's responsibility to initiate the pre-certification. That's handled directly between the providers and the plan. Not all services need prior authorization. Some common services that would require prior authorization would be planned inpatient hospital stays, surgeries, complex diagnostic care like CAT scans, PET scans, MRIs, skilled nursing facility or rehab facility, all of your therapies like your radiation therapy or physical therapy or occupational therapy. Those are some of the most common services that would require the prior authorization. Once again, that's handled directly between the provider and the plan. Now, Medicare handles review of medical necessity retrospectively. So a claim can come in and Medicare will review the claim, and they could determine that medical necessity guidelines were not met and reverse and deny that claim, which would mean that the member would be ultimately responsible for that full bill. So the prior authorization on the front end actually helps members so that there's no surprises. Members and providers know that all medical necessity has been met for that service before the service is rendered. So the prior authorization is there to protect members. And obviously, if there is an urgent situation where we need to expedite a prior authorization, there's a process in place to process those expedited prior approvals within 24 hours. On this slide is a snapshot of some of the member communication pieces that your retirees will be receiving. The first one is the notice of change letter, and this is the letter that came out from the City of New York, and it was sent in August. So most members or all members should have received by now that initial notice of change letter from the city, which kind of rolled out the announcement of the New York City Medicare Advantage Plus plan and how that's going to work. Followed by the notice of change letter is the pre-enrollment guide. And we are mailing the pre-enrollment guides out in phases. So we're mailing approximately 30,000 per day, and they started to mail on September 7th. The first wave of the pre-enrollment guides that are being mailed are for senior care members, and then all other plans will be followed. So if you're covered under HIP VIP or Aetna, for example, your pre-enrollment guide will be coming in the next few weeks. Included with the pre-enrollment guide is a copy of the frequently asked questions document that's also posted on the Office of Labor Relations site. They've tried to capture some of the most commonly asked questions and put them in one single document. So that's also included in the member communication mailing, as well as a side-by-side benefit comparison between the GHI senior care plan and the Medicare Advantage Plus plan. Now, following enrollment into the program, all members that are enrolled in the Medicare Advantage Plus plan will receive their new identification card. And this will be the one single identification card that members will show to their doctors or to their hospital. And that will come in December. So all members that are enrolled in the plan will receive their identification card before the 1st of January. Following the identification card, members will receive a welcome guide. And this is a guide that goes into a little bit more detail about the program and how members can access various programs that are included in the benefit package. Following that, throughout the course of 2022, we will be sending member newsletters out throughout the course of the year for topical topics that are relevant to the retiree population. Members will also have access to view online their full evidence of coverage, which is the full insurance certificate. Members can also request a hard copy be mailed to their home if they would like a hard copy. They also have the ability to request a printed directory for the area in which they reside. So if a retiree wants to call into the Welcome Center and I want to have a directory for a certain area in Brooklyn, they will send out a provider directory for their area. They can also request a provider directory for the Florida address that they live at if they are a snowbird. We won't be able to print the full directory because it's over 640,000 providers nationally, and that would be a very cumbersome directory. So it's based on geography, so the member can dictate which areas they would like the provider directory printed for. Now, the enrollment or opt-out process, this is a question that has come up quite often, and I know that Lou had reached out to me prior to this meeting to make sure I review in detail exactly the opt-out process. So what will happen is the City of New York will be automatically enrolling every Medicare eligible retiree and Medicare eligible dependent into the new New York City Medicare Advantage Plus program. Now, members have the ability to opt out of the Advantage plan if they choose to remain in the current plan that you are enrolled in today. So if you're currently a senior care plan member and you want to keep senior care, you have the ability to opt out to keep the senior care plan that you have today, with the understanding that if you opt out to retain the senior care plan, the retiree and eligible dependents will have to buy up to keep senior care. So the buy up premium for the senior care plan is $191.57 for the base plan, $2.83 for the hospital rider. So it's a total of $194.40 per member per month. So if you have a husband and wife that want to opt out to keep senior care, it would be approximately around $400 a month in buy-up premium. Now, on the Office of Labor Relations site, they do have posted the premium rate sheet for all of the plans for 2022. So you'll be able to go on to the OLR site to view the rate sheet to find out what your applicable buy-up premium would be if there is a buy-up premium to retain your plan. When you fill out the opt-out form that will be included in your pre-enrollment guide, you can either mail that opt-out form into the address on the form, you can fax it in, or you can email it in, or you can opt out telephonically with a member service representative on the welcome call line, and that's 833-325-1190. Once we receive your opt-out form, we will be sending out an opt-out confirmation letter to all retirees that opt out to keep their current plan. And it's basically a confirmation that retirees understand by opting out, they will be responsible for their applicable buy-up premium, which will be deducted from their pension on a monthly basis. Another question that comes up is, what if I have a dependent that's not on Medicare? I have an underage dependent or an underage spouse. What will happen is the Medicare eligible retiree will be enrolled into the New York City Medicare Advantage Plus plan, and the non-Medicare eligible dependent or dependents will stay on the GHI CBP plan. So the City of New York requires that both the retiree and all eligible dependents are enrolled with the same carrier. So the companion plan for the Medicare Advantage Plus plan will be the GHI CBP plan. In regards to union supplemental benefits, I wanted to take this time to let you know that everything that you're receiving through the LBA, the welfare fund that you get today, will not be impacted by this Medicare Advantage changeover. So for those retirees receiving their prescription drug benefit through the LBA, you will continue to receive your prescription drug benefit through the LBA. This will not have an impact on that. I wanted to call out a few important sites and phone numbers for you. There's a lot of information that the Office of Labor Relations has posted on their website. It includes plan comparisons for all of the programs that the City of New York offers. It also includes the frequently asked questions document, full benefit summaries, and all of the other forms. It also includes a hyperlink that goes directly to the empireblue.com dedicated website for City of New York Medicare Advantage Plus members. And on that site, you will have access to additional documents and information, as well as links to all of the general education sessions that we'll be holding. We will be also conducting general webinars for all New York City members through the course of September and through October. So if there's anything that you may not have got from this presentation today and you want to hear the information again, you can certainly log into one of those general sessions and hear the member presentation again. Now, the opt-out period will run from September 15th through October 31st. So all members will have roughly 6 weeks for the opt-out process. So the opt-out process will end on October 31st of 2021. Once again, the call center is 833-325-1190. And those representatives will be there to answer any benefit questions you have. They can look up providers for you, and they're there to really just assist you along the way. Lou, is there anything else that you want me to touch upon that I need to go into a little bit more detail? I do want to say one thing. The Medicare Part B reimbursement will continue. So the City of New York will continue to reimburse Medicare Part B for all retirees that are enrolled in a New York City eligible medical plan.
Yeah, quick question about the opt-out period or the opt-out. So if a member decides they don't want to opt out and they want to stay, they want to try this Advantage Care, and they're not with Senior Care, they're with another provider, and they try the Advantage Care, and in 2022, they make a decision, you know what, the Advantage Care is not working for me. Do they have the ability to go back to the plan they came from if they didn't opt out?
Yes, the City of New York is going to be opening up the fall transfer period on an annual basis. So if following next year, they decide the Advantage plan is not for them and they want to go back to their prior plan, they will have another opportunity to change in the fall of 22 for January 1st of 23. So they will have another opportunity to go back to their current plan if they choose to after next year.
So that'll be just one opportunity, then that'll be 2022, fall 2022 to opt back in if they want to do that, Kim?
Yes, so they'll have the opportunity to go back in their current plan. So let's say they are a HIP VIP member and they do not opt out for January 1st of 22. They try out the New York City Medicare Advantage Plus plan and decide I want to go back to HIP VIP. They will be able to do that in the fall of 22 for a January 1st, 23 effective date. Now, after 2023, the members will be able to switch between Senior Care or the Medicare Advantage Plus plan.
Understood. Real quick with the Part D. So most of my members, a good amount of my members are happy with the union plan because of Marianne, not because of me. Now, the question I have is, they decide they don't want the Medicare Part D right now. They're happy with the union plan. But let's say next fall, they decide, you know what, I want the Medicare D. Can they go do that?
Retirees will have the ability to purchase the enhanced drug plan during the next fall transfer period. So they can do that.
And that's for COBRA recipients or the Medicare recipient, correct?
Correct. The COBRA participants will have the ability to make that change during the fall transfer period.
And with the opt-out, if the member is not in, do both, I guess both the husband and wife or have to opt out together, or is it one form? Or does the member opt out consider everybody opting out? How does that work?
For all Medicare eligible participants, they're seen as individuals. So you could have a husband and wife, both of them are Medicare eligible. They will each get their own separate form. So they each have to opt out separately. And it's important to note that one cannot opt out and the other one stay in. So they have to make the decision together. They're either both staying in the Medicare Advantage Plus plan or they're both opting out. So they can't be split.
And what happens if they fail to do that? What if one mails it in and one doesn't? What do you revert to? The plan that they were in or the Advantage plan?
What's going to happen is we are going to be logging all of those opt-out forms. And if we find that we only receive one for the retiree and we're missing the spouse, we're going to be doing follow-up mailer to that spouse stating that we received. And the retiree will get a confirmation letter, but we're trying to make sure that we get all of the forms in, whether it might be a telephonic outreach to that retiree or a letter, to make sure that we get the opt-outs for both of them.
Excellent. Bill, you have anything you want to ask?
Yeah, Kim, just real quick. What's going to happen with the people that are becoming Medicare eligible, Medicare age this November, this December? How are they being notified? Because obviously they're not Medicare now, but they will become January 1.
We received what's called an age-in file, aging into Medicare from the city of New York. So they will be proactively mailed the pre-enrollment guide as well in phases. So if they're becoming Medicare eligible in November, they will receive the pre-enrollment guide in November talking about this change. So we've captured those retirees that are not 65 or Medicare eligible yet, but will be from now until December 31st.
Okay. And then I have one specific question, and I think I know the answer, but I just want to get confirmation from you. I have somebody who turns 65 January 30th, so effectively their Medicare coverage starts January 1 of 2022. My assumption is they automatically go into the Medicare Advantage?
Yes, correct.
Now we also have other categories, and one of them is the Cobra for Life widows. Are they receiving the mailings also?
They will have an opportunity and an option to choose the plan. So the city of New York has chosen not to automatically enroll those Cobra for Life participants, but they will have the ability to choose the Medicare Advantage plan plus plan if they want to. So they can enroll in that. So there are some Cobra for Life members that pay the full premium. Some Cobra for Life plan participants, the premiums paid for by the fund, depending on the circumstances. So if there's a surviving spouse that's on Cobra for Life and they're paying the full premium, they have the opportunity to reduce their costs by quite a bit by enrolling in the Medicare Advantage Plus plan. Under senior care, they're currently paying, I think it's like $210. Their Medicare Advantage Plus premium would be $7.50 for those Cobra participants.
So are they? So they're going to receive mailings from Alliance or from the city?
They're going to receive something separate that is telling them that they have the opportunity to choose to enroll. So they would then contact the Office of Labor Relations, I think fill an ERB form out to be able to switch into the Advantage plan during this fall transfer period. So the Cobra members are going to be treated similar to the regular fall transfer period, where plan members can make plan changes.
All right, and just for clarification, Kim, you just touched on it. We receive a lot of questions from members about what happens when, or if, well, no, it's when they pass before their spouse. So if a member is on the Medicare Advantage Plus plan with his spouse or her spouse, and the spouse passes away, can you just explain the Cobra for Life coverage for the surviving spouse, the $7.50 per month for 2022, and then what happens?
So if you have a retiree and spouse, both of them are enrolled in the Medicare Advantage Plus plan. come 2022, and during 2022, the retiree passes away, that surviving spouse will be eligible to continue the Medicare Advantage Plus program through the Cobra for Life benefit, and they will pay the full premium of $7.50. So that will occur the month following the passing of the retiree. They'll be able to continue it, and they would be direct billed for that $7.50.
And then what happens after 2022?
It depends on the Cobra rules. Some retirees are eligible for Cobra for Life, and they can stay on it indefinitely and pay the premium. Or there are some participants that are eligible for Cobra for only the 36-month period. What will happen in 2023 and 24 and so on is the premium for the Medicare Advantage Plus plan will be zero premium. So for the outer years, it would be a zero premium. So they would be able to continue under the plan for no premium at all.
So just to summarize, and tell me if I'm wrong, Kim, if a spouse passes away in March of 2022, or a member passes away in 2022, that's on Medicare Advantage Plus, the spouse will pay $7.50 a month for Cobra for Life for the remaining months of 2022. For 2023, 2024, and 2025, there'll be zero cost to the Cobra for Life.
Correct.
All right, and after that, we don't know, because then the contract is up.
Well, it goes 5 years. So we have 22, 23, 24, 25, and 26. So what
Just shows that
happens
my
for
math
27?
stinks. I'm sorry, go ahead.
No, I'm sorry. I may have missed the follow-up.
He just said his math stinks. That's
My
all.
math stinks. I couldn't count to 20.
All right, Mayor, you have any questions, man? You good?
No, I'm good. I'm good.
All right, well, Kim, I appreciate the time. We videotaped this. We're gonna put it out to the members. We had about 12 questions sent in from the members that were answered online, but probably a lot of those questions some of our members may have. So we're gonna get those questions and send them out to everybody to follow up. Again, I understand that this is a big undertaking by you guys over at Alliance. I understand our members are concerned about this. Again, any questions you have, please just send us an email. We'll take a look at it. We'll try to get back to you. We're trying to make this as seamless as possible for our members throughout the country. But I do appreciate Kim and your team putting this together for us. And our members that will be on our website probably by well, Lee's here, hopefully by the end of the week or somewhere around there. We'll put it out there. And that's really all I have. So I appreciate the time, everybody, and be safe. Thank you. Thanks, Kim.
Thank you. I appreciate the opportunity.